Our team of 340B experts work with our clients to help guide them through the process of billing Medicaid, whether that be their states or registration on database. It's important to work with someone who understands not just 340B, but your state-specific Medicaid requirements and federally qualified health centers.
One expectation for 340B covered entities is that they will prevent duplicate discounts from occurring. What is a duplicate discount, you may ask? That's when a 340B covered entity would receive the 340B discount on a medication that they purchased, whether that's for a clinic-administered drug or for a medication that they dispensed at their entity-owned or contract pharmacy, but then also Medicaid fee-for-service sought a rebate on that drug as well. So how do we prevent that from happening? It's a really important question. So there's a lot of elements to consider. First of all, we want to think about federal requirements, then state requirements, and then how is your organization operating? We put all of those together. We decide how to set up your program specifically to make sure that you're being compliant. So on the federal side, you need to understand the 340B program operations and designating on the OPACE database. We talked a little bit about that in clinic-administered drugs. And so just making sure that when you are listing as carving in or carving out for your covered entity, that you understand how are you billing for your 340B drugs. And if you are purchasing 340B medications at your clinic sites or at your in-house pharmacy and you're billing Medicaid fee-for-service for them, that you're answering yes to that question on the OPACE database, and that you're also listing your Medicaid billing numbers for each of the states that you're billing in on the database as well. Really important that you check on that at least a couple times a year, if not each quarter, to make sure that your billing information is accurate and up to date. Now for the state information, this is where it can become a little bit more difficult. You may need to work with your Medicaid billing agency or get online and see if they have published what the guidelines are for your state. Each state is different, so you want to make sure that you understand what your requirements are. First of all, are you even allowed to carve in for 340B for your state? If you are, do they have requirements for you listing on the Medicaid exclusion file? Do they require you to use billing modifiers? What is your state's process? Once you understand that, you're going to look at how does your covered entity operate? And what is your capability within your covered entity to be able to comply with that? Sometimes we see that health centers' medical records are not able to address the challenges of submitting modifiers that the state may require. This may mean that they cannot carve in Medicaid drugs because they cannot meet the billing requirements that the state has for their expectation. So really, it's important to put together your federal requirements, your state requirements, and your covered entity's capabilities. Make sure that you are able to comply with all of the expectations, and that way you'll be set up for success with how your program's operating. You will not be in a situation where you're creating a duplicate discount, and you'll always be HRSA audit ready.
So in addition to your clinics, your in-house pharmacy also has to be compliant with preventing duplicate discount. There are several ways to do this depending on what your state requirements are, but one of the most common ways is adding modifiers to the claims. This can sometimes be a challenge if you have to do it on each claim that you submit. It really relies on your staff being trained to be able to add that modifier, but there are really better ways to do it. Our team can work with you to add the modifiers into your pharmacy software where it's added automatically depending on the rules of the claim. So it will add the modifier when it's required, but then it will leave it off for those retail claims when you don't have to have it. This allows you to maintain that compliance with minimal staff training and minimal interruptions to your daily workflow.
So we talked about the importance of making sure that your Medicaid exclusion file that's listed on the Office of Pharmacy Affairs Information Database, or OPACE, is up to date and accurate. But how do you make sure that that information is right? So one way is to work with your billing department within your health center and understand what are the billing numbers that you are using for each of your clinic's billing departments and for your pharmacies to actually submit your bills. Frequently, an area of risk that we see is that each health center site will have a billing number, but they may or may not be billing under that number. They may actually be billing under the organization's main NPI or their main billing number. And so really important that you understand how your system is operating and that you're listing the correct billing numbers on the Medicaid exclusion file. In the event of a HRSA audit, if you have the wrong numbers listed, you will at minimum get an inaccurate database finding. And worst case scenario is that you may have caused a duplicate discount to occur, and HRSA will ask you to conduct a corrective action plan, which could involve repayment to manufacturers or to your state Medicaid agency. One of the ways that we're able to help is coming in and assisting you with assessing your Medicaid billing practices and making sure that your OPACE designations are set up correctly to avoid this in the future. We've talked a little bit about Medicaid fee-for-service and duplicate discounts there, but what about the managed care organizations? So first, it's really important to understand where are our statutory obligations and what's required by law within the 340B programs. There's a little bit of a difference between Medicaid MCOs and Medicaid fee-for-service. Within the 340B statute, there is a requirement for covered entities to prevent duplicate discounts from occurring. So that means that all of the responsibility for preventing those duplicate discounts ultimately lies with the covered entity. In the case of Medicaid managed care and preventing the duplicate discount from occurring there, the statutory language that creates protection around that actually came from the Affordable Care Act. And when that language was crafted, it actually put the onus on the state to prevent those duplicate discounts from occurring. So fee-for-service, the obligation is on the covered entity or the health center to prevent it. With managed care, the obligation is on the state to prevent it. So very important to understand those two different obligations and make sure that you are understanding what is the mechanism that your state has set up for Medicaid managed care to prevent duplicate discount from occurring. You're not going to be using the Medicaid exclusion file that you do with your fee-for-service unless your state is telling you to do so. Because we see Medicaid managed care operating through numerous pharmacy benefit managers, each of those plans can choose to operate differently. This can create significant areas of risk for covered entities. While we've said that the responsibility for Medicaid managed care, prevention of duplicate discounts sits with the state, and that is factually correct, we can tell you what we see in practice. And that is that at the end of the day, if the state has a duplicate discount that is created, it's really the state's discretion on how they choose to have that remedied. In certain states, we've seen that the state has created the repayment with the manufacturer. In other states, we've seen that the state has directed the covered entity to repay the manufacturer for the full amount. And in some situations, we have seen that the state has had the covered entity do a rebill process for those claims to the state to do the correction with the state directly. So make sure that you understand your Medicaid MCO billing processes and how those interact with your 340B program. Make sure that you are complying with those requirements, but at the end of the day, make sure that you also understand that even though it's the state's obligation to prevent those duplicate discounts, that you are going to have the potential to be held accountable as well.
Monthly, we work with our contract pharmacies to review 100% of contract pharmacy claims for Medicaid fee-for-service and MCO. If we discover that any MCOs or fee-for-service plans were billed at our contract pharmacies, we will work with our clients and those TPAs to reverse the claims and get those plans blocked so they are not billed in the future.
We've mentioned that each state has different Medicaid billing practices and the importance of complying with your state's requirements. But how do you identify what those requirements are? There's a few different ways you could go about doing this. One is just reaching out directly to your state's Medicaid billing office. If you have a great relationship with your Medicaid department, this may be your best way of accomplishing identifying this information. The second way is getting on your state's Medicaid website and looking for documents that would identify the billing requirements. You may also find them on your state's Board of Pharmacy website as well. Often just searching 340B in the documents is a helpful way to find any documents that address the 340B program. And then another really helpful resource that's been developed recently is on the Apexis 340B Prime Vendor Program website, so 340bpvp.com. They do have a resource that covers all of the states and many of the territories and their 340B program requirements, including links now to references for each of the states. They do their best to keep that updated, and if by chance you are from a state where you are aware of new information, they do ask you to alert them to any changes. All of these are great ways that you can identify what your state billing practices are so you can make sure you remain compliant with your 340B program. It's always important to begin with the end in mind. And for covered entities, one important piece to be prepared for is the potential of a HRSA audit. When you receive that HRSA audit letter, it's a moment where you have a lot of nerves, and one of the biggest areas that you need to be prepared for is the Medicaid section. So if you are carving in for Medicaid, there are a lot of expectations HRSA has for you. They're going to want to know about your policies and procedures on how do you handle Medicaid fee-for-service. And then they also are interested in understanding how you're handling Medicaid MCO as well. Within the context of the audit, because the 340B statute addresses fee-for-service, they're only going to be auditing claims that are processed under Medicaid fee-for-service for duplicate discount compliance. They will audit all claims for diversion compliance, but they will not be testing your Medicaid MCO claims for compliance with state Medicaid MCO billing requirements. Important distinction to understand. But as far as your Medicaid fee-for-service claims go, they're also going to ask you for a billing form for every site that you bill Medicaid fee-for-service for. That can be a heavy lift, so it's a great exercise to practice with your billing staff to make sure that they're able to pull that information for you. On those claims, it's really great to make sure that you have a medication on there. And if you don't bill for medications, it's also great that you understand to be able to explain that to HRSA, that we bill our items bundled and we do not bill for our medications separately, because they will ask you to provide documentation to that effect if that is how your organization operates. Another piece within the HRSA audit is that it will ask for your utilization data, both from your in-house pharmacy, your contract pharmacies, and for your clinic-administered drugs. Within each of those areas, they will do testing on your billing processes. For the in-house pharmacy and the contract pharmacy, they'll ask about the payers and do checking there, again, looking to see that you're preventing Medicaid duplicate discount. But for the clinic-administered drugs, if they find any samples that were billed to Medicaid fee-for-service, they will again ask for billing forms there, and they will go through and make sure that you've complied both with the federal requirements and your state requirements, and any potential areas where you missed the mark could result in audit findings. So really important that as you're setting up your program, you're taking this into consideration. Where our team is able to help is working through your processes with you, understanding the state and federal requirements, and making sure that your program is set up right from the beginning and that you're HRSA audit ready at all points. If you're not sure how to do that and you would like help with that process, please don't hesitate to reach out to us using our website, FQHC340B.com.